Welcome to our podcast, Dr. Prarthan Amin. How are you doing?
Hi, Dr. Smita. I am good, doing good. Thank you so much for having me, first of all,
Yeah.
and really love and appreciate the work that you guys are doing in terms of educating people, advocating for specialization, surgeries, etc.,
Yeah.
and also advocating for general health awareness. So, thank you so much for having me, and excited to be here and fire away all the questions that you have.
Our platform is Health Commune. We are calling it as a global health literacy project.
Mhm.
Overall, the knowledge about health is so low. That's why it's expert led communication. I'm a doctor, so I'm asking a question that I should ask on behalf of people to the
Yeah.
expert doctor. And today's topic we are discussing is why spine surgery is safer today than ever before. You're a spine surgeon.
Yeah.
Before we get into my questions, if you can quickly tell us your specialization, where you are practicing, what you do.
Yes, so as you correctly said, I'm a spine surgeon and I'm an orthopedic spine surgeon. So I
Hmm.
post my MBBS, I did my residency in orthopedics from Ahmedabad, from NHL Medical College Ahmedabad, a proud alumnus of the same. But since the last 6 years, actually, I've dedicated my focus, my resources, everything into developing myself as a spine surgeon. So post MS, I have done multiple fellowships in spine surgery, which include from Stavya Spine Hospital, which is in Ahmedabad, which is a tertiary spine care center, from New Delhi, Indian Spinal Injury Center. And also, I've trained abroad from places like Hospital for Special Surgery, which is in New York, and Rothman Orthopedics, which is in Philadelphia. Since the last 1 year, I've been doing the spine fellowship in Toronto, from Toronto Western Hospital, which is University of Toronto. It's under the University of Toronto umbrella, but it's a hospital which is actually a specialized center for neurosurgery and orthopedics. It's actually the biggest center for neurosurgery, and so three of my bosses were orthopedic spine surgeons, and two were from neurosurgery background, neurosurgical spine surgeons. And so that was the training I had. Since then, came back to Ahmedabad, which is my hometown, and I've joined as an assistant professor in one of the medical colleges here. It's called MK Shah Medical College or SMS Multi-Speciality Hospital, and I'm focusing on spine specialty myself. Though I'm an assistant professor of orthopedics, I'm focusing most of my time in spine related surgeries, spine related clinical care, and spine related research. So this is my quick intro, quick or not so quick intro.
Yeah, and I think you're the perfect person to ask these questions. I come from the
Mhm.
time when it's like a very old school surgery and old school education that we have taken, and now everything is with technology, AI, robotics. My time, nothing was there. But you have seen and you have traveled the world and you have taken fellowship from different places which are like advanced centers. So I think you're the perfect person to answer the questions on behalf of the whole Aam Janta of India we are going to ask. Now, when we talk about the spine surgery, when do we need? What are the clinical conditions where the spine surgery is required?
So the clinical conditions, I would say, is a broad spectrum. So someone might require it for, say, a deformity correction. So if someone with scoliosis
Yeah.
is not happy with the curves, or is actually developing some ergonomic issues because of the deformity, scoliosis or kyphosis, those people might require. Then there is a broad age population who are above 40, 50 years of age, who are developing degenerative wear and tear in the spine. And because of that, they might be developing some spinal instability or nerve pinching, and which is causing them a lot of issues in their activity, in their daily habits, stuff like that. So those are the one other population. Then I guess the third population set is people in the 20s, 30s, who are rash drivers, unfortunately, and they unfortunately undergo road traffic accidents, or construction workers, workers who are in in the field, who unfortunately have a big fall, and they develop spinal fractures which need stabilization. One population is definitely young and old, is in our country, is unfortunately tuberculosis of spine. So TB of spine, which
Got
is unfortunately still very prevalent.
Okay.
Despite the government's best efforts and everything, it's still, we see these patients day in and day out.
Okay.
which we don't see in the developed countries.
Got
So
it.
these are the whole spectrum, and then there is inflammatory conditions like ankylosing spondylitis, in which patient spine fuses, and they might have a fracture, or they ergonomically they are not able to see straight. They're all crooked and bent down, and that's one of the patient populations in which require surgery, spine surgery.
Okay. And what all different kinds of procedures that you perform? Of course, I know that it is very condition specific, the treatment that you are offering based on how much of the complications that are there. So just to put a context
Yes.
together, what are different kinds of procedures that you perform?
Broadly speaking, most of the spine surgery cases can be divided into two. So either we do a decompression surgery, in which we basically burr down the bone, we take out the bone and free the nerve roots where they are getting pinched. But we don't fix the spine. So this is done when it's an isolated nerve-related issue. We decompress the spine. And second is fusion surgeries. So fusion can be short fusion or long fusions. Fusion is the surgery in which we put in screws, we put in cages, and we try to fix the spine, either because it's unstable or it's deformed or something like that.
Okay.
So broadly speaking, for different pathologies, these are the two kind of surgeries we perform most often.
Very interesting. So now I'll tell you, I for me, I am super scared of even spinal anesthesia. Being a doctor, like many years back, especially when I was studying, how we used to do these surgeries in the past.
Yes. So if you ask me, like, it's the last 20 years in which spine surgery has actually evolved very beautifully,
Yes.
and lot more to come, but it has evolved very beautifully to such an extent that if you bring a spine surgeon from say 1990s and put him into the modern day operation theater, you would not be able to recognize the surgery at all. So like it's that difference. So before, spine surgeries were actually done in sometimes in a lateral position. So to avoid blood loss, they were done laterally. Now we make the patient prone. A lot of changes have happened to anesthesia as well. Not only that, so like if 20 years ago, I would say we didn't have different fixation modalities. The amount of fixation modalities we have right now, we didn't have them. So 20 years ago, like I would be with the patient's relatives or patient's family as well, in thinking that if, or rather, if I was there as a patient relative, I would be scared. Like if the patient was in the OR, I would be scared, and I wouldn't know if the patient would be paralyzed or not when he comes out. It would just
Yeah.
be something which would be like fate or chance or something like that. So in the last 20 years, I would say it has evolved very beautifully, very, very beautifully, into much safer surgeries now.
And how do we do now? Like, I'm aware about the minimally invasive surgeries.
Yeah.
I'm aware about the robotic surgeries. How do you do the surgeries now? Like, how the spine is handled now?
So a lot of improvements, and again the 1% analogy which I said. So like it's not just one big thing which has led to the whole thing, but it's 1% improvement in everything
Wow.
overall, which has improved. So as you said, rightly said, minimally invasive spine surgery. So we don't cut as much in terms of the incision, so the blood loss is lesser. We don't strip the muscles more. So think of it like pulling down the curtain just to access the spine versus going through the curtain. So now we split through the muscle rather than burning or cutting through the muscle, what we used to do before. Lot less muscle loss, lot less blood loss, lot less length of stay which the patient has to be in the hospital since surgery, lot earlier recovery. So in 20 years before, if someone had a spine surgery, they would be bedridden for weeks. Like
Correct.
the
Huh.
doctor's advice would be to keep them bedridden for weeks,
Yes.
keep them
Yes.
catheterized for weeks. So they would be highly dependent on care, nursing care, on their family relatives, a lot of burden on them as well. Now it's get them standing. For most cases, get them standing as early as possible, even mobilizing them on the same day or the very next day.
Oh, wow. Okay.
Yeah, yeah. So like a lot, like it's like a seismic shift which has happened the last few years.
Technologically speaking, like what changed in the OT? Are we using better visualization machines? Are we able to diagnose it faster? Are we using more precision? What actually changed? How the OT evolved that is making us, it's much safer and more precise for patients, and which we'll speak about, like what's the advantage for each one of them. What changed in the OT?
I would answer that question on four pillars. I mean, pillar one would be the instruments itself and the techniques which have changed. So, as you rightly said, minimally invasive. So now we have instruments like the tubes, which literally pass through the muscle fibers, in between the muscle fibers, and sort of dilate them. We can do like a keyhole surgery and get out with much less blood loss. So, like I'm saying, 1/10 of the blood which we used to lose earlier. So that's number one, and including specialty equipment, implants, stuff like that. That's pillar number one. Number two is actually with the advent of further imaging. So initially we had, I remember the days in which they actually literally had to do X-rays inside. They used to take the plate, used to wash the plate, bring it after 30 minutes, and then show it, and then intra, and then
That's all the memory I have.
decisions. So now we have 2D fluoro, which is an
Oh,
C-arm in which they take X-rays and you see digital X-rays immediately. Then now we also have O-arms or intraoperative CT scanners, which actually create a three-dimensional anatomy. So we get three-dimensional anatomical knowledge. And even better than that is now we have navigation.
hmm.
So we can, with use of trackers, smart trackers, and this 3D CT data, we can actually fuse it to basically form a three-dimensional space around the patient. And while we instrument, we can see where we are going. So we can actually navigate, and we
Wow.
can actually put in much precise, much more accurate implants now.
Wonderful.
So
Okay.
so that's pillar number two. Pillar number three is lot of changes, improvements to anesthesia. So it's not just surgery, it's actually multiple teams working together. So anesthesia team has probably improved in terms of, first it was gas-based anesthesia. Now we have TIVA. We have some blocks. So they can put in erector spiny blocks, which are muscular blocks, which help a lot with the pain. So they require much less anesthesia, including during surgery and post-surgery.
Wow.
And the patients also have much less blood loss. The BP doesn't shoot as much, so they are taken much better care of by the anesthesia. So that's pillar number three. And pillar number four is the new age technologies, which is, say, robotics. There is AR and VR, virtual reality and augmented reality, in which you literally, they have meta glasses, and you can create a hologram of spine on the patient while we are operating, and navigate through it. There are also new changes in sensor-based technologies. So like instruments are getting more smarter, more better, which can actually develop or guide the surgeon much better.
I still remember, like, I went to Jaipur and it was a printed map, and we used to actually
Yeah.
read, and then we used to navigate and ask people, like, bhaiya ye rasta kahan jata hai, right? Versus now you have Google Maps, you just add the location and you're just driving there, right?
Yeah, definitely.
And if so much of now advancement is there, why this kind of advancement was needed? Was there anything that was missing that point of time, that it pushed the whole technology and the scientists and innovators to give you such kind of equipment?
Yeah, I mean, yes, definitely. So like 20, 25 years from now, it was just the surgeon skill, which was of the utmost importance. So the surgeon has to be skilled, and even in the best hands, there are complications. So like even with everything, there were complications. So everything was freehand. You basically rely on your anatomical knowledge to put in the screws, etc. Versus now, the whole concept of what a modern day surgery should be is actually surgeon skill, or which is obviously of the utmost importance, but now enabling technologies, which include navigation, robotics. So it was a safety, it was a surgical safety which actually pushed, and imagine the amount of value you can add by making spine surgery safer. Like before, it was people who didn't know if they were coming out paralyzed or not post surgery because of
Correct.
the surgery. And now it is much, much more safer. I wish it could be, I could say it was 100%. It's not 100%, but it is so much safer now that people have much less concerns now. So I can just imagine like some innovator or some researcher sort of, I can imagine the drive why they would be into this field of making surgeries much safer.
Now, when we put this advanced ecosystem that you have, I won't just call it a technology because it's a whole ecosystem. Anesthesiologist is empowered. There is lots of AI. There is AR. It's so much of things are there. Now let's see about who all the stakeholders in this ecosystem. We have a patient, we have a surgeon, we have an anesthesiologist, and we have a caregiver. Those who need to take care of patients at home. Okay, after the
Yes.
surgery and all. So now
And also
let's
rehab.
and
That's,
rehab. Yes,
yes.
yes, yes. So let's see how this whole advancement of the efforts towards safety and this whole advancement of this ecosystem that is there for the surgeon now, how it helped. Let's start with patients. So how it's benefiting patient.
For the patient, I mean, the difference is huge. So now we actually have ERAS, so Enhanced Recovery After Surgery Guidelines. So patients used to be in the hospital for weeks altogether, immobilized, catheterized. They had to be taken care by nursing teams. Obviously, this impacted bed availability in the hospitals. So in place like India, where a lot of people require care and we don't have enough beds, this obviously is a burden on the healthcare system. Now it's the concept is of enhanced recovery after surgery. So things start actually before surgery. So what people now call prehab, in which you optimize the patient even before surgery happens. You make them so that they recover better, they recover faster. So prehab is one. Number two is say doing modern anesthesia, which you rightly said. So that is there. Number three is the surgical team itself, the enabling technologies around the surgeon, uh, the nursing care. So now we decatheterize the patient much early, we mobilize the patient much early. Uh, they are able to resume their activities much earlier than before. And
Correct.
then post-operative rehabilitation, which is the last piece of the puzzle and the most important, I would say, much more important than even the surgeon, is how the patient keeps on recovering and how much care is given in the post-op recovery. So there is a lot of changes in which they are using robotics now to improve their gait, to improving their muscle function, etc., etc., etc.
Correct. And with this surgery, when we talk about safety, when we talk about, let's talk about safety first. So it is safer for patient in what terms? Like if I'm a layman and you come and say, because of the advanced technology, now it is safer. Safe in what
Yes.
sense?
So safe in the sense that you will not likely bleed out because of the surgery. So the intraoperative complication of bleeding out is less. With related to nerve injuries or spinal cord injuries. So because of the technologies, now you will get much lesser nerve injuries or spinal cord injuries, which makes the surgery more predictable. So we can actually be comfortable in saying that, you know what, this is what will happen post surgery now. That this is what happens in most cases, and this is what you will experience post surgery. So that sort of, we have now the confidence of giving that. So technology has definitely made that much safer. Third is sterility practices, technique practices, smaller incisions, smaller surgeries make the infection rate much lesser. So wound complications, infection related complications are much lesser now as compared to what it was before. So all of this is the spectrum of making surgery safer.
Safer.
As a layperson, I would say you would have a much lesser blood loss, much lesser length of stay, much lesser chances of paralysis, much lesser uh, time to recovery now as you would have had before 25 years, 26 years.
Okay. Oh, that's amazing. And now it clarifies completely
Yeah,
how it is helping doctors. I can imagine without all these things, it was so much of stressful, right? We don't talk about doctor stress in the OT
yeah,
environment and how much it must be causing stress to them. But
yeah.
then, as a one doctor to another doctor, right? Like, is it now little at least predictable that okay, this is going to it's less stressful with the technology around you?
Oh, 100% it is. I mean, so imagine this scenario. You have just cut open someone for a big surgery. So now that person is bleeding out completely. That person has BP fluctuations. The anesthesiologist is saying, you know what, you need to close immediately because we might lose the patient. I mean, we have an objective of doing the surgery, but life is obviously number one.
Of course.
So we might lose the patient in while doing the surgery. So imagine this versus now imagine doing like a small incision, much less blood loss. You know where you are putting in the screws yourself. So you have obviously the surgical skill, the tactile feedback, and everything. But now you also have technology, which is literally like guiding you. Like literally when you're like driving car and there is sensors which are saying that you know what you're going to. You need to park better. On your left there is something coming, and you're going to bang into something, and then that's why you are much better. Even though you're a good driver, but you need a good navigation with you. So all that, plus there are instruments in the surgery. So like for example, initially we had all handheld instruments like the Kerrison punch
Yes.
to take out the bone, but now we have specialized ultrasonic bone scalpels which cut through bone, but they don't injure the nerves or the dura that often.
Okay.
They are much safer. So like even when going through the bone, we have technology, or the burr which or the drills which we can use in intraoperative. So I'm saying there are multiple ways in which this has improved. But yeah, surgeon stress, imagine uh, someone bleeding out in right in front of you, or someone you cut through the nerve root, and imagine the stress then versus
Of
now
course.
you have a lot of technologies which is helping you,
Correct.
and better surgeons make better patients. So if you're less stressed, you make better decisions,
Yeah.
you do better for the patient.
I can understand that with this advanced technology, doctors, anesthesiologists, nursing staff, and most importantly, patient over here, it's huge, huge benefit. We know that, right?
Yeah,
But then our system is, if you look at our healthcare ecosystem, the way we work in India, it's not very transparent enough, right? If I'm a patient, if I reach out to a doctor, doctor suggests that okay, you have to go for a spine surgery. I cannot ask doctor that are you going to use the advanced technology for my surgery or not. We can't, right? Like
yeah.
I mean, I don't know if I'm a patient, if I'm and probably I'm not a doctor, I'm just a normal person. Then how to even ask doctors how to approach this? Because if I know the advantage, I would go for it, isn't it?
Yes, yes. And you are very right. There is this unknown barrier, unknown to us as well sometimes. So the patient might have some presumptions in the mind and might not be able to speak out their mind.
Correct.
And what I always say is a very good doctor is the one who can take things out of patient's mind. So you can preempt that, you know what, these guys are worried about something or something like that. Another thing is a good doctor is the one who is very transparent and is able to communicate everything to the patient. So you are
Mhm.
very right. So this fear has been there in the patient's mind that they can't ask the doctor's questions. But I mean, I would say have faith in your doctor. A good doctor or your good treating physician is the one whom you can ask the patients. And if you can't, that is an issue. That is an issue, and you need to take a second opinion.
Correct.
So
Correct.
there are some ways in which you can do this. I would say for the patients, even if there is someone very intimidating, you can always ask questions like, you know what, doctor, are there some enabling technologies you can use during surgery, which will make my surgery safer? Or you can ask, doctor, are you going to do this the minimally invasive way? Or will I need a open surgery? So
Yeah.
you
Yeah.
can definitely communicate in a way in which and I can understand the patient's perspective because there is a surgeon
Exactly.
component somewhere in India that the patients are also very scared to ask or be forth. A good clinician and a good surgeon is the one who can preempt this, who can see that this is happening, that the patients are unable to ask him, and does this by himself. So like he makes sure that the patient is able to communicate better to them by asking leading questions, by asking, making them more reassured that you know what, you can ask me anything.
Correct. And and I think there is no harm. I don't see that it's a practice in our country that we check which hospital have what kind of infrastructure before I go for a particular procedure.
Yeah.
We still
Yes.
go with the doctor. I know of doctor who's suggested by uncle, auntie, and rishtedaro ke recommendation.
Yes.
Uh,
Yes. Yes.
we still do that. But then if you want such kind of a procedure, and if you want something good for your own health, and if we check what's there in the hospital, what infrastructure is there on the website, people add
Yes.
on their website, hospital website, that what infrastructure they have, what equipment they have, it's there. How many we check, it's the question. See, and this is another problem with how people should think or would think, that if you are using so much of advanced technology, so many equipment and all, the price of the procedure will go higher. So advanced technology is expensive versus the normal surgery, probably. Is
Yeah.
that true?
It is true to a certain extent. So things like better anesthesia, use of some agents, like there is an agent called tranexamic acid, which actually makes blood loss lesser. There is use of specialized equipment. So some for some things it's not that expensive. So it's not that you always need to have AI, robotics, navigation, etc., in your OT. It's still safer because of a lot of other things. But yeah, you're right. So these things, obviously, the high-end things like AI, robotics, navigation, makes the surgery much more expensive to do. That is an issue with the Indian healthcare system because of the ecosystem that we are in. We are not able to translate that for each and every patient right now. Which
Yeah.
is, for example, in the West, you would see this as a norm. A lot of stuff as a norm, that what, surgical safety is important. The insurance companies know that, the government knows that, all their policies are like that. Somewhere in India, we are still not aligned there. Um, for example, there is an Ayushman Bharat scheme, which has done phenomenally well for patients. A lot of patients without a coverage now have coverage, but unfortunately, with the package rates that we have in that, we are not able to do surgeries with, obviously, this high end stuff. We still rely on the ways of 20 years back. So this is there. It is an issue. We are also, as surgeons, as doctors, we are advocating to the insurance companies, to the government, to make this better. If it's a private insurance, most of them know that, what, this is better for the patient. This will actually reduce the blood loss, length of operative stay. The patient will be much healthier, and will end up benefiting them. So their packages usually are okay with robotics, navigation, etc., etc. They have this leeway. But on the public side of things, where with government schemes, we are all also advocating to third party insurers or government, that we need to do better here. It's definitely improved the coverage, but we need to do better. 100%.
Correct, correct. Are these surgeries covered under private insurance, or it's not?
Most of them are. Most of the spine surgeries are covered, because it's quite a serious issue most of the
Yes.
times, and it's something which the patient actually requires. It's a health issue. It's not something like a cosmetic issue or a elective issue. It's more or less something affecting their daily work life. It's something affecting their daily function, and most of the private insurance
Okay.
does cover it, including the government insurance actually covers a lot of spine surgeries, but it's just that we can't use the extent of technologies that we have available because of the costs which are involved with it.
Correct, correct. And those who are doing out of pocket expenses, is it fair if I say that, see, the cost of the treatment or cost of the surgery with advanced technology is XYZ amount? Okay. But then if you go with the conventional option, the recovery time, then the bedridden time that you have, and then your family will be taking care of you. So that's a different cost altogether, right? It's a complete
Yes.
cost of the illness itself versus the cost of the surgery. I think that's where probably patient can take a decision whether it's a good
Yes.
investment into their health for a long term benefit, or they have to think about this. But yes, not everyone can
Yeah.
afford. That's also true in our
No, no,
country.
you are bang on. You're bang on in saying that, because what we see is upfront cost. As a patient, from a patient perspective, what you will see is, first question from a patient perspective, who are not, they are financially strained, would be surgery ka kitna ho? How much would it cost for the surgery to happen? And suddenly you don't see the post-op care and the medicines, like increased cost of the medicines incurred there, the cost of you not mobilizing enough well, the cost of injury. So if you get an injury or an infection, so it is much better. Most of the studies also done in the Western countries have repeatedly proven that doing more enabling technologies in the OT is actually better from a cost perspective, broader cost perspective, for the patients, for the government, for the insurers. For everyone, it is better, because if your length of hospital stay decreases, if your length of medication use decreases, if you are quicker in recovering, it is much less strain on the healthcare system and on the
Yes.
financial finances.
I agree, but then let's see where the whole insurance and healthcare expenses in India, how it'll shape up. I have a
Yeah.
quick rapid fire round for you,
Okay.
which I would like to ask. Okay, my first question is paralysis a common risk in spine surgery today? Today, not 20 years back.
Not really. Not
Hmm.
really. I wish I would say it was 100%, no risk of 0% risk of paralysis. It's not 0%. It's much less than 1% for most surgeries. Only in the very high stake surgeries in which, the cord is already really compressed. So spinal cord is really compressed are the cases in which, or very bad deformities are the cases in which you have a higher risk than 1%. Most of
Okay.
the risk is less than a percent of neurological compromise.
Okay. Now I have a second question. Probably I'll ask you this twice. Do spinal implants frequently fail or need replacement?
Most often they don't, which is the case in 95 to 98% of the cases. You don't require to remove them. They'll be there for lifetime. They wouldn't cause you any harm or foul, except that when you pass through airport security, they might detect it once in a while. But the modern age biocompatible titanium implants or the cobalt chrome implants, these are the materials which we use, are very safe. They are designed to last for a lifetime. So
Okay.
most of the times you don't, unless it causes issues like impingement or stuff like that.
And I'll ask this question again by a little modifying it, that do spinal implants or surgeries performed with the advanced technology frequently fail or need replacement?
Most of them don't. So no, they don't. There is a chance that it might fail eventually. So fail. There was a term called the failed surgery, which actually most of the journals also have advocated to remove this term, because
Correct.
so if someone gets operated on at a level and the level above fails after a few years, that's not a failed surgery. It's another issue which has happened. But
Correct.
because of this term, sometimes they used to go and consult, and the doctor used to write in their prescription that this is a failed back syndrome or a failed
Yeah,
surgery
yeah,
syndrome.
yeah.
That actually signals to the patient that something went wrong in my first surgery.
करेक्ट करेक्ट हाँ एंड
Yeah,
दिस यूज टू हैपन लाइक इन नेबरहुड राइट लाइक हम पहले वो डॉक्टर के पास गए थे वहां पे सर्जरी फेल हो गया फिर हम दूसरे डॉक्टर के पास गए और वहां ने
yeah,
करेक्ट
yeah, yeah.
कराया करके दिस
Yes,
दीज
yes,
स्टोरीज
yes.
यूज टू हैपन या नाउ माय नेक्स्ट क्वेश्चन इज स्पाइन सर्जरी always associated with severe pain?
Not necessarily. In fact, with the use of modern day blocks, which we use just before we cut or incise, we actually use very specialized blocks, which is called erector spiny blocks. There is a thoracolumbar facial block, which actually reduces even the pain requirement during anesthesia. So during anesthesia, they are better. Post anesthesia, they are better. For most patients, I would say they have a soreness for the first few days post surgery. So first 2 to 3 days post surgery, there is a soreness, there's a discomfort in the back. And as a country, we don't use opioids that much, which is actually a bad thing. In the Western countries, they use opioids. The patient is much happy in the post surgery, but because of the opioid, it has also caused misuse issues. We don't use, so there is a soreness issue for the first 2 to 3 days post surgery in India, which is usually in the back. It's not something which limits them. So we usually mobilize them on the first day. So for most cases, no, it is not painful. I would say it's discomforting, but it's not painful.
Okay, perfect. My next question is age still a major limiting factor for spine surgery? Do you operate for geriatric patient as well as pediatric patient, or it's specifically for adult human beings?
Usually it's not. So like pediatric patients, we recently operated on a 3-year-old kid.
Oh, mhm.
Yeah. So and we only do that if it's completely indicated. So that kid had a tuberculosis of spine with a deformity. So the spine was literally like falling out of place. and we had to fix it. And in that, we had to employ very different strategies from what would do for a normal spine surgery, because the bones are not that well formed. But the later aspect is where the majority of the question lies. So in young age, if we have to do it, we have to do it. It's not an option then for the patient as well or for the surgeon. It's the older age where this question is much more relevant, because say if someone is 80 years old, and they have an issue which is limiting their daily function, which is causing them issues. This is the misconception that, you know what, I can't do surgery now because I'm 80 years old. I shouldn't do surgery now because I'm 80 years old. And that's where the concept of physiological age and chronological age comes. Sometimes 80 years old are much fitter than what a normal 60-year-old is, because they have taken care of their health so much.
Correct. Huh?
And that's also where the concept of frailty comes. So age is the number. You actually there are multiple criteria on which you decide on how frail the patient is, how well the patient will be able to tolerate your surgery. And this is where the whole mindset has shifted. So even in Toronto, I remember this one gentleman who was, I think, 84 years of age. 84 years
Okay.
of age.
Uh-huh.
If you
Mhm.
look at him, he was like a 50-year-old.
Oh, wow. Uh-huh.
He was so fit. He used to go hiking, he used to do skiing, and he was so fit. He had an isolated issue at one level. We did the surgery. He was so happy with the surgery. Age was never an issue there. There was no comorbidities. He was not hypertensive. He was not diabetic. He was not a smoker. He was not an alcoholic, etc., etc., etc. And he tolerated the surgery phenomenally well. So, like, age is not the issue. Frailty is an issue. So if someone is very frail, if someone does not have the blood reserve, for example, to tolerate a surgery, or the
Yeah.
patient does not have other issues, the patient has other issues, like he's a smoker, patient is a smoker, or he or she is a smoker. In that case, we have to optimize the patient before. So we can still do a lot of optimization before and still give a surgical option for them.
Okay. Amazing.
Yes.
Yeah, oh, that's very interesting. My last question to you is: what's the most rewarding part of your life as a spine surgeon?
Oh my God. So, most rewarding part for any spine surgeon across the world, and I am taking the liberty of saying this on behalf of all of us, is seeing a paralyzed patient, completely paralyzed patient walking. And
Wow.
oh my God, what a feeling it is. Like you can see the smile, like the glow on his face, the glow on the patient's face, his or her face, when someone with, say, a road traffic accident or sudden paralysis, acute onset paralysis, can't move his limbs, is unable to breathe, gets back after a month and a half or 3 months and is walking and thanks you. So like it's like there is no feeling like it. Believe me.
Perf- I can imagine. I can imagine what you're saying. Looking at you.
Yeah.
Okay.
No, because we recently like we had two of my patients, like saying from my own this that we operated on a person 21 years old guy, um, who had an unfortunate construction worker related accident. So he fell down from the fourth floor and was paralyzed, couldn't move his legs because of a fracture. And we stabilized the fracture. He was very regular with his rehab, and he came down walking. And
Wow.
like, what a feeling that is! What a feeling!
Yeah. And if technology can help, and I like it to I like to talk to doctors, those who have studied over here. They get exposure with different countries, like you were in New York and then in Toronto, and all these
Yeah.
advanced technology you see globally, then come back and in India, working in the academic setup as an assistant professor. It's so good to talk to you, doctor. It's amazing to talk to you, like brilliant.
No, thank you so much. I actually am humbled that you sent an invite to me in this, and I appreciate what you guys are doing.
Yeah.
It's so nice to give back after you've been trained so well. Even I feel like there's so much potential in India in terms of the healthcare delivery we can do. Our healthcare system is way better, believe me, from the Western counterparts in terms of access to the patient. Patients now have a very good access, especially in tier 1 cities, but even tier 2, tier 3 cities, they're getting much better access than our Western counterparts. it's the specialized care, and we have a lot to improve there. There's a lot of potential there as well. So I see a lot of opportunity there, and hopefully we get there. We get even better in delivering a specialized care to our patients, doing better surgeries for patients than we seeing all around the world.
Definitely, and I can see that happening. And I would like to thank you on behalf of my team and Health Commune Complete Platform
No, really
for giving
appreciate all
us.
of you guys. Thank you so much. Thank you so much for this opportunity.
Thank you, doctor. Thank you so much.